Our next guest with us for the next 15 minutes. Very excited. Fresh
Let's
off
do
of
it.
a very early morning rescission bill vote, Senator Tammy Baldwin. Welcome to Point Taken.
It's great to join you. I'm not sure I'm fresh off of
I don't know if you slept last night.
2:15 a.m. vote, but I'm doing my best.
So actually, let's start there because it was this morning voted that the $9 billion DOGE cuts with foreign aid and public broadcasting cuts were codified. And so I also just saw on the Hill a headline that says GOP airs concerns about Trump's use of rare tool to cut funds despite backing bill. So in your conversations that are not on the floor, that are just with your colleagues on the other side of the aisle right now, how much concern that doesn't reflect how they're actually voting?
Yeah. Well, certainly, especially with regard to some of the public media provisions in this rescissions bill, I heard a lot of concern about especially those who represent states with big swaths of rural areas, that public media is how they get their emergency alerts, how they get local news. And we've seen so many local news outlets close in recent years. We have some counties now in Wisconsin. We have one that has no local news source at all. And we have some public media that are reaching, most of Wisconsin's North Woods, for example, even some of the Upper Peninsula of Michigan. Without those, if those radio stations, for example, were to close, to shut down, there would be no source for weather alerts, amber alerts, and local news content. And so people are very concerned about that. I had a lot of Republican colleagues talk about that off the floor, on the floor, but not willing to stand up and vote to eliminate these rescissions. And so, I offered them a chance. I offered an amendment that would have saved the Corporation for Public Broadcasting, which is the vehicle through which these local radio and public television stations receive some of their funding.
Senator, one of the big questions is what this does to health care, about rural hospitals, and certainly that matters for much of rural Wisconsin. What are your specific concerns in that area? Because that's something that impacts everyone day to day in this state.
Yeah, so in that budget reconciliation bill, there's a projection that the consequences of passage of that legislation will result nationally in 17 million people losing their health care. Some of those people receive their health care through Badger Care, Medicaid. Others will lose their health care because of changes in policy with regard to the Affordable Care Act and the lapsing of tax credits that help people afford the premiums. And that combination in Wisconsin will result in more than 270,000 Wisconsinites losing their health care coverage. That has downstream consequences. So if rural hospitals and clinics are increasingly then treating people who are uninsured, their bottom line is impacted. We have a significant percentage of our rural hospitals in Wisconsin that are operating year to year at a loss. This will compound it, and it will probably make their continuing operation really in doubt. We know already that there are 3 rural hospitals in Wisconsin teetering on the edge. This bill is going to make it worse. And we'll also see other changes in behavior with regard to rural hospitals and clinics. They'll stop providing the services that are the least profitable. We've seen way too many maternity wards close because those tend to be those do not tend to be profit centers for our rural hospitals. And we've seen mental health services shuttered because of the same economics. And so, again, a lot of ramifications of this bill on the health and well-being of Wisconsinites.
So it's interesting, though, because a lot of the Medicaid changes don't start until January of 2027, correct?
That is correct in terms of some of the reporting and red tape
Okay.
that will be put up. But there's still basically $1 trillion being taken out of the Medicaid program over a time horizon of 10 years. And we will see ramifications, I think, earlier than that. And especially worrisome to so many of the Wisconsinites I was interacting with during the consideration of this bill. By the way, I did roughly a dozen Medicaid roundtables from Superior to Racine and from La Crosse to Green Bay. I mean, I just crisscrossed the state listening to folks. And one of the things that people are very concerned about are with the Medicaid, what they call Medicaid waiver programs. These are programs that allow, say, a very sick child or somebody with complex medical and disabilities receive both health care and ancillary services that connect them to that health care and keep them well and functioning in our communities. They're really worried that some of the things on the early chopping block will be those ancillary services that just really make it possible for people to live independently outside of nursing care or hospital care. And there's a lot of worry right now about that.
Senator Tammy Baldwin joining us on Point Taken on 620 WTMJ. One of the things that your other senator, our other senator in the state of Wisconsin, Senator Ron Johnson, talked about for decades was the deficit. Now, he sort of moved away from that conversation and supported this bill, even though it had what I would call serious impact on our federal deficit. I guess my question for you is, how much do you think about when you're working on this bill, you're talking to your colleagues, you're talking to people across the aisle about that number, which we know is getting into the 30s of trillions of dollars. How much does that figure into what you're thinking about day to day?
Yeah, it's a huge concern. And look, the last election was litigated about the high cost of things. And really voters were saying, you got to bring our costs down. You got to bring our healthcare costs down, our grocery costs down, our energy costs down. And we're seeing a whole bunch of activities by Republicans in this administration that are doing just the opposite. And in this particular bill, one of the reasons why government expenses have gone up is the interest on the debt. Interest rates have gone up. The debt has gone up because of the Trump administration's previous tax bill in 2017 and decreasing revenues and therefore increasing deficit and debt. And this only makes it worse by the tune of, by some estimates, $3.5 trillion in additional debt to our nation over the next 10 years. And so when I saw our Senate's deficit hawks, as they call themselves, turn over and vote for this bill, it was just truly shocking, especially given the fact that a couple of them said, there's no way we're voting for this bill because it adds to the deficit. And only when it got worse did they then say, oh, now we're going to vote for it. This is really ridiculous, and it should be of concern to everyone that we should not be giving enormous tax breaks to the wealthiest among us and profitable corporations to balloon the deficit. We should be much more fiscally responsible than this bill is.
Senator, that was my follow-up question. As far as I wouldn't consider you a deficit hawk, but as far as it being something that you are concerned about, what are the policies that you see us course correcting to get out of this debt? Is it raising taxes on the wealthiest and the profitable corporations?
Certainly, we should have everybody pay their fair share. And this bill did just the opposite. The greatest benefit of the tax provisions in this bill will inure to the benefit of profitable corporations and the wealthiest among us. There are a modest number of tax provisions that are claimed to be helpful for the middle class. Most of those, by the way, expire in just a couple of years. But the other measures affecting and benefiting billionaires and profitable corporations are made permanent in our tax code. This is going to continue to spiral in a way that is harmful. And what do they want to do to pay for that? They want to cut more from the most vulnerable people in our communities. People who do rely on tax credits to pay their premiums for the Affordable Care Act insurance, people who are on Medicaid, people who have benefited from nutrition assistance programs like the SNAP program. That's who they're cutting in order to pay for tax breaks for billionaires and big corporations. And that is just ridiculous.
Senator, I only got about a minute left, but I wanted to ask you this question. The big story in Wisconsin is both looking forward and today there's some speculation the governor may not run for re-election. It would be his third run. I know you're a fan of the governor. You've been around the state with him many, many times. Do you think he should run? And do you know anything about the fact that he might not run?
So I don't have any inside information, but I want to say something that's really connected to the conversation we just had, because the state budget was unfolding as we were debating this budget reconciliation bill. And in the final hours, Governor Evers negotiated really strong language that will help Wisconsin be able to work with some of these rural hospitals and clinics to keep them potentially open where the budget reconciliation bill would pressure them to close. And I am so grateful for the governor's leadership in that regard.
All right. Well, we got lots more questions, so we're going to have you back. But Senator Tammy Baldwin, thank you so much for spending time with us today.
Thank you for having me.